Good afternoon, everyone. My name is Marcela Gaitan, and I work with the National Alliance for Hispanic Health. The organization is implemented the Nuestras Voces, our Voices Network program. Thank you, everyone, for participating in the webinar. We're hosting this webinar today in conjunction with our colleagues from the Appeal Network. I'm going to switch now to our colleagues from Appeal so they can introduce their program.
Great. Thank you so much, Marcela. My name is Camille Mendaros. I am the program coordinator for Appeal. I just want to give a brief overview of Appeal in our national network called Aspire. So if we go to the next slide, Marcela, next slide, please. Thank you. Appeal is a national nonprofit, and for almost 25 years now, it has provided key leadership, advocacy, technical assistance, and resources on health justice issues for Asian American, Native Hawaiian, and Pacific Islander communities, or AA-NHPI for short. Appeal is also the parent organization of the Aspire Network, which is one of the 8 CDC-funded national networks working to eliminate tobacco and cancer health disparities in priority populations. And the Aspire Network specifically work with AA-NHPI populations. And then if we go to the next slide, you will see our Aspire Network map. Right now we have 7 network partners in total located in the continental U.S. as well as in Hawaii and U.S.-affiliated Pacific Islands. Next slide, please. So through Aspire, we provide a lot of technical assistance and training to other nonprofits, CBOs, state health departments, and other entities who work with or want to work with AA-NHPI communities in either tobacco and or cancer prevention. So here are just some of the technical assistance and training topics on tobacco and cancer prevention that we offer. So leadership and capacity building, program evaluation and needs assessment, tobacco and cancer educational materials, policy recommendations, and research and data. And then next slide, please. I know we have a few representatives from state health departments in the audience, so I'd like to mention that we are finalizing our cancer prevention needs assessment survey that we will ask cancer prevention state program managers to take. So this needs assessment survey is just a way for us to gather information on the successes and challenges that each state has when it comes to working with AA-NHPI populations in cancer prevention. So we'll evaluate the results to determine appropriate technical assistance and training needs for each state who wants to work with Appeal in the Aspire Network in addressing AA-NHPI cancer prevention. So we'll be reaching out to each state individually in the next month and a half and ask for your participation in taking the survey. So thank you. That should be it. Back to you, Marcela.
Neil, we're gonna now switch to Nuestras Voces. Bear with me for a second. Okay, I'm gonna make it full screen. Okay. Again, thank you everyone for being in today's webinar. We're very excited that we got to participate, to organize this webinar for our colleagues from Appeal. We are also, the Alliance is, I'll just give a little brief overview of the organization. We're a non-profit public health organization. We're based in Washington, D.C., and we work with a network of community-based organizations around the country that provide services to more than 15 million Hispanics around the country. And our membership includes a variety of organizations, individuals, government agencies, for-profit and non-profit organizations, and in conjunction with all the membership from our members, they serve more than 100 million people annually. Our mission is best health for all, and our vision is strong, healthy communities whose contributions are recognized by a society that fosters the health, well-being, and prosperity of all its members. We are also part of the, as Camille mentioned in her introduction, we're also one of the networks that are part of the CDC consortium that are addressing, are actually implementing specific interventions or activities in public health related to the prevention of commercial tobacco use in related cancers. Nuestras Voces is the purpose of Nuestras Voces is to expand multi-sector networks in their capacity to effectively address the threats of commercial tobacco use and reduce the burden of cancer in Hispanic communities. We also work with our partners around the country. We're currently working with 6 organizations: Centro de la Raza in Seattle, Family Health Centers of San Diego, Dia de la Mujer Latina, Chicago Hispanic Health Coalition, Hispanic Federation, Hispanic Health Coalition of Georgia. They are the organizations that we partner with to implement some of the activities that we're conducting as part of the program, because they have we have a long history of working with these organizations and different activities at the Alliance, but also they operate networks that are regional, and they can actually amplify the messages and the collaboration and the activities that we do through the Nuestras Voces program. Some of the things that we do through the program is we address health equity by connecting Hispanics to cultural proficient tobacco and cancer information. We also collaborate with different organizations addressing the health needs of the community in relation to tobacco and cancer. We forge community-based partnerships for capacity building and program implementation at the local level. We also support the development and implementation of tailored interventions that are culturally proficient and also language appropriate. And we conduct training and technical assistance on tobacco and cancer control, evidence-based interventions and promising practices to reach and serve Hispanic communities. And based on this activities to the training and technical assistance, that's what we are conducting this webinar with Appeal on addressing cervical cancer screening. I'm sharing just this slide because I want you to see some of the most recent statistics in terms of the incidence and the mortality of cancer. And as you can see, underserved populations have some of the higher rates in both incidence and mortality as well. Another thing that I want to emphasize, and it goes along with the webinar today, that is, cervical cancer is preventable, and as we know, it's estimated that in 2019, more than 13,000 women will get cervical cancer, and then over 93% of these cancers can be prevented. And as many of you know, the human papillomavirus is the cause of most cervical cancers, for which the HPV vaccination helps prevent this infection. And also the Pap test helps screens for abnormal cells that may develop into cancers. Now, that even though we know screening works, when you look at the numbers for women who get screened, and in the last, in 2015, for example, in the last 3 years, we have numbers such as, for example, for non-Hispanic Black, 70.6% of women had a PAP in the past 3 years. Among non-Hispanic white, 60.8%. Among Hispanic, 60.6%. Asian, 64.9%. In American Indian, and Alaskan Native, about 60.9%. And even though screening works, there are still a lot of missed opportunities for the prevention of cervical cancer. And now I'm very happy to introduce our 2 speakers for today's webinar. They are Rosa Barahona, who is a project manager in the Department of Preventive Medicine at the Keck School of Medicine of the University of Southern California. She has devoted most of her career to working on participatory community-based initiatives, bridging academia with community-based settings, and working with promotores de salud. Ms. Barahona has extensive experience in implementing health education and promotion campaigns, both in Latin America and within the Latino communities in California. We also have Ashe Minix, a graduate from Baylor University with her MPH in community health education in 2000. She graduated in 2015. Before coming to Hope Clinic, she worked with the Louisiana State Office of Public Health as an STD HIV prevention specialist and statewide rapid testing trainer. She also worked for the American Cancer Society, providing technical assistance to hospital programs seeking to obtain or maintain Commission on Cancer accreditation. She currently serves as the program management and outreach coordinator for Hope Clinic and has been in this role for just over a year. Thank you, Rosa and Ashe, for being as part of our webinar today. So I'm going to go ahead and give Rosa your turn to speak. Bear with me for a second. Okay, there's a long list of people. Just a second. Barahona. Down. Sorry, I had to go to a long list of people. Oh, right here. Okay, Rosa. All yours now.
Hi, thank you, Marcela. Can everybody see my screen?
Yes.
Okay, thank you. Okay, well, thank you for inviting me to do this webinar. Today I am going to be talking about our Es Tiempo campaign here housed at USC. I have been with the Department of Preventive Medicine and also with the Norris Comprehensive Cancer Center. So our Es Tiempo campaign is an evidence-based campaign that is focused on increasing cervical cancer screening among Latina women here within Boyle Heights area. This campaign uses a nature, which is the tree of a jacaranda, that if you live in California, you're very familiar. It's the purple tree that usually blooms between the months of April through June or August. Now, with the whole climate change, that has been given an impact, but I'll tell you a little bit more about that. And the idea is to create an association between the campaign elements, screening and HPV vaccination of the jacaranda tree. This campaign was first initiated back in 2010 and was originally funded by the Norris Comprehensive Cancer Center here at USC. However, the preliminary testing for the campaign elements came through a small funding that we were able to obtain through the California Community Foundation. So as Marcelo already reviewed, cervical cancer is one of the most common preventable diseases and is the second most common cause of cancer worldwide, pretty much. So I want to share a little bit with you today some of the data here in California. You can see that Hispanic women still have the highest incidence of invasive cervical cancer compared to non-Hispanic whites, African American, and Asian Pacific Islanders. Unfortunately, still Hispanic women have the lowest incidence of cervical cancer screening. So it is definitely something that has really come up to our attention and has been of great concern. So what we decided to do here at USC is actually come up with a unique partnership. The campaign was established with this unique partnership that dealt with the Art Center College of Design Matters program here in Pasadena, the Annenberg School of Communication and Journalism, and the Norris Comprehensive Cancer Center and the Department of Preventive Medicine here at the Keck School of Medicine. And really, it is a large cast of individuals that have contributed at different points in the development of this campaign. The Art Center was very important and playing a very important role because they actually connected us to several students at their program that actually were able to do some preliminary work on our campaign, Es Tiempo, which included expanding our and the understanding of those involved regarding the significance and the look and feel of local cultural imagery. We decided we wanted to do something very creative and that really reached out to these women. So we partnered with them to be able to capitalize on the creativity of students and faculty there to help us carry our message. Once initial agreements were established, the first step was to train the students and have them go into the community. And the Es Tiempo students were trained by USC investigators on cervical cancer and Latinas, and we conducted a mock pap test with a dummy at County Hospital and attended lectures on these issues. The Art Center students also went out into the community and did their own ethnographic research, which they used to inform the campaign and get the feel and better understanding of the community. This is the next step that we're going to be discussing a little bit further down the line. For the development of this campaign, we went ahead and utilized a community-based participatory and culturally centered model that has been successfully used by many of our partners here at the Patient Education and Community Outreach Center at Norris. And this model pretty much creates partnerships between communities and academic researchers to build, strengthen, and enhance effective and culturally grounded interventions that promote health. It reduces disease risk and overall enhances well-being. The model works via community input and shared knowledge and informed decision-making using assets in the community. So with the availability of the pap test and human and HPV vaccine, no woman should really have to die from cervical cancer. So this campaign aims to reduce the prevalence of cervical cancer through increasing screening and HPV vaccination among vulnerable groups. The first phase of the campaign will focus on Latina women in Los Angeles, and we hope that we can implement it on other ethnic groups as well to see how it works and resonates as well. The campaign is an evidence-based campaign which array with the HPV educational resources for healthcare providers and consumers, and multilingual patient education materials. This is a formative research that was done via 12 focus groups, and the materials have been pilot tested among 2 community clinics in Los Angeles, which I'll provide with a little bit more detail about. I will now focus on some of the findings from our research and solutions that the campaign addressed. One of the identified needs by the women in the focus group was that they needed reminders of when to come in for screening, follow-up, or whether they need to vaccinate their sons or daughters against the HPV through following the 3 vaccine doses. Now remember that this is a campaign that initially started in 2010, and since then, we have had to make different adjustments in order to be in compliance with the new changes that have been occurring as new findings have been arised. So the solution of this campaign presents is to create a culturally appropriate reminder system. One other problem that was reported by many of the women that participated in the focus group was that they needed to know where to go for low cost and free screening and HPV vaccination information. So our solution is to provide maps and graphics that can help identify the local free, low-cost clinics where they can obtain cervical cancer screening and HPV vaccines. So in order to do this, once we obtain all this information from the focus groups, we went ahead and, with the students from the Art Center, wanted to develop a logo that conveys 2 main messages at the time. First is, when it blooms, it is time to schedule your PAP. And when it blooms, it's time to get your or your child's HPV vaccine. Now, in order to do this, we went ahead and developed several different design elements to our Es Tiempo campaign. And again, we have been adding several things as the years have been passing by. We always have had the participation of 2 clinics here in Boyle Heights, which is the community clinic here named Clínica Monseñor Romero, And we had an intervention site as well as a control site in Pico Union. So this were about, I would say, about 20 to 25 miles radius in distance between both of the cities. We also went ahead and developed posters and postcards that were utilized by the participants at the clinic. Here is a picture of the poster that was actually revised because initially we went ahead and had a multilingual Office of Women's Health hotline, but unfortunately their funding came to an end. So we went ahead and contacted and worked closely with the clinic to see if there was a similar hotline that they can provide. So we went ahead and had to update the posters and all the materials for this year. We also have identified promotoras, community health workers, to help us with conducting community workshops by delivering information about cervical cancer prevention out in the community, and we also have collected community intercept surveys. Here is the images of our outdoor media campaign, and this is generally the message that we want to convey out to the community. We have it both available in English and Spanish, and you will see that we have added all of our partner logos as well, who have been able to provide us with some support, whether it's financially or just resources. So these are messages that we went ahead and put out on lampposts, billboards, and also bus benches. Some of the impressions that we're actually receiving through the billboards is that we're actually outreaching to about 17,000 to 59,000 individuals to see some of these images throughout the community. So I just wanted to mention how important it is to use some of this outdoor media campaign when trying to gear a message out to the community. One of the additional items that we have included with this campaign is that we have also developed a toolkit for which we already have several of main elements, which I have outlined here on this slide. The toolkit would include fact sheets, PowerPoint presentations for young adults, teens, and adults, and also the elderly women, and provide sample messages for providers to remind women to go in for screening and vaccinations. The toolkit would include short tested messages that can be used as text reminders for clinic patients. And also available through the toolkit will be downloadable postcards and send home reminders that can be used by the various clinics that we are working with. I am now going to share with you a couple of the findings from the outdoor media campaign and from the community intercept surveys that we have collected. Today we have collected approximately 221 women that we have interviewed through a community pilot, where mostly spoke Spanish at home and are Spanish speakers themselves. And they have heard, about 60% of them have only heard about the vaccine. The main important thing here is that about 41.6 said that they would be likely to make an appointment to get a pap test, and 47% said that they were extremely likely. But unfortunately, many of these women did not know even where or how to get access to or assistance to making some of these appointments, which is important as to why it is critical to have a hotline number when doing an outdoor media campaign. Within our clinic intervention, what we did is that we had our intervention or our control clinic. And within the intervention, we had about 1,428 women, which 46% of them became compliant with screening guidelines during the duration of our campaign. Only 33% were in the control group, which is the Pico Union area. So when we exposed our outdoor imagery and the posters of the clinic, there was actually a 13% significance difference between experimental and control conditions. Out of these, 65 women who had not been in compliance previously got a pap test during the campaign intervention period, which really made us very happy to see some of those results and findings. one of the things that we had to do is work very closely with the clinic, because the clinic has had a lot of staff turnaround and a lot of changes in the leadership. So it has been very important for us to maintain those relationships with them, and also through the transitioning. So even getting to know some of the new leaders has been very crucial to us, because that's one of the items that have actually helped us continue with this campaign and working with the clinic. With having new people being involved, it's important for them to understand not only the history but the importance of the changes and how many of their leadership is making a difference within the community. Before I go into the conclusions, I do want to say that it is also important to work closely with the other media campaign vendors. They have been the ones that are actually been informing us to some of the city permits and changes that have taken into place when carrying out a campaign such as this. So I can't emphasize enough as to how important it is not only to be in communication and stay in tune with many of the changes from at the community level, but also at the various levels, because that will make the campaign more successful. So here, what we did in conclusion, we wanted to identify cultural elements that resonated best within the particular communities, especially within the Hispanic Latino community, and that's how we came about with the jacaranda tree that blooms, which it doesn't tend to be the same for other states around the U.S. So that's something that you have to keep in mind, what is really the cue that can be conveyed to the community. Culturally based interventions may be particularly well suited for reducing health disparities among Latinos, and have advantage to appealing to individuals from cultures within strong histories of storytelling. But underutilized culturally relevant tools in health communication for Latinos may be the need for a narrative is a useful tool that can be conveyed. It is important to work with local, municipal, state, and federal governments and community health workers. Our community health workers have played such a major role with this campaign, because they have also been the bridge for us to be obtaining not only data within research, but to stay in communication with our community nearby here at the USC. And having sent them to actually conduct workshops have been one of the great emphasis here within the community. And we actually been hearing a lot from the community women sometimes when we conduct the intercept surveys, that sometimes they tell us, oh, well, are you going to hold any of the future workshops, or they're interested in learning more. And that's all thanks to the work of the promotoras and the community health workers in their involvement in this campaign. There are several examples that provide strategies that can be used, not just on cervical cancer, but also on other diseases, that I think that this campaign can teach us with various different elements that we have learned throughout the time. Here is a link to a video link that I wanted to see if, I know we have some time, that I wanted to share. Hopefully it works. If not, there's the link that you can actually visit. And it pretty much, it doesn't seem to be working. Okay, and it pretty much just shows, oh, it may. Nope. It pretty much just shows what a pap test really entails and what the procedure is, but it does it more in a comical way that it can actually resonate with the community, and it provides with information as well as to where to get resources. So I want to invite you to actually visit this link, since I can't seem to get it to work here at the moment. There's an 11-minute video and also a short video, which is about 3 minutes. But I think it is a very good tool that we have been able to create. And I'm happy to share that we actually have received several awards for this video that was created by some of our students here, and also by our colleagues from the Annenberg and communication unit here at USC. Okay, that is it for my end. Thank you so much for your time. And I think we'll be taking questions towards the end. Is that correct, Marcela?
Yes, thank you very much, Rosa. I meant to say that at the beginning, that we're going to have the two presentations, and then we will be having questions at the end of before the program ends. But if you want to write your question right now, in case so that way you won't forget it, feel free to do it on the chat box that it says for questions, and we'll be happy to go through those when the other presentation is completed. And also, I wanted to remind the participants that we uploaded some resources, so you are able to download those as well. And thank you very much. Now we're gonna have Asha Minix. Asha, let me give you now. I'm gonna give you, if I can find you here on the list. Right here. Thank you, Emory. Okay, bear with me for a second. Do you have it? Asha, are you on mute right now?
Okay.
Oh, that's cute.
That's my puppy. Well, she's not so much a puppy anymore. But let me go ahead and bring up there we go. So hello. I will be talking about Hope Clinic and our Papalooza Cervical Cancer Screening Event. So I'll be giving you a brief introduction of Hope Clinic, why we chose to do this Papalooza Screening Event, some statistics about that kind of better explain why we chose this particular thing, and then also a step-by-step how-to, as well as some of the outcomes in terms of the number of patients that we were able to serve. So I'll get right into it. So Hope Clinic, we're a federally qualified health center here in the southwest part of Houston, Texas. We have 3, almost 4 locations. Our 4th location will go live on August 5th, so we're really excited about that. We started in 2002 as a 4 hours a month volunteer-only clinic, and from there we grew and grew. In 2005, we were professionally staffed, and then in 2012, we became a federally qualified health center, and we have been growing at a 25% year-over-year rate since then. So last year we saw approximately 21,254 unique patients, and we hope to top that this year as well. We're actually right on track to do so. So I'll move on to the next slide and talk about why we chose the Papalooza. So we identified a need for affordable cervical cancer screenings in our service area. We are in one of the most ethnically diverse service areas in all of Houston, and as most of you probably know, Houston is one of the most diverse cities in the nation, and our little cross section, our catchment area, is actually the most diverse portion of the city. There's about 125 to 140 different languages and dialects that are spoken in this region, and it's also the most densely populated. So we have a lot of underserved folks, a lot of uninsured folks, a lot of documented as well as undocumented immigrants. We have quite a number of refugees who resettle in this area. So there was a huge need for that, for affordable and also accessible health screenings, because we found that there were so many women who had not been screened in at least 3 years. And we saw that a lot of them, it had been 5, 6, 7, sometimes 10 to 15 years since they had had any type of Pap test, HPV test, or even a clinical breast exam. The really nice thing about the Papalooza screening events is that we're able to move people through them very rapidly. And then with that, you're able to get multiple cancer screenings in one. So for women who are age eligible, they're able to receive breast cancer screenings as well as FIT testing for colorectal cancer as well. So you can see here looking at our demographics in Texas in terms of race and ethnicity, that we are quite diverse, with Asian and Pacific Islanders just under the national average and Hispanics at well over the national average in terms of demographic breakdown by race here in Texas. So just looking at a couple of statistics that are really relevant to our clinic and reasons why we chose this particular intervention. If you look right here, if you can see my mouse, this right here is Harris County. This is where Houston, Texas is located. And so we have some of the most linguistically isolated folks here in this little corner of Southeast Texas. And so because in our clinic we speak over 30 languages in-house, we're able to provide not only culturally competent services, but also linguistically appropriate health care to the majority of our patients. And so now we're going to look at the fact that our screening rates are not the best in terms of cervical cancer. We see here that Texas is indeed in red. And so looking at this, we can see the number of females who have not had a Pap test in the past 3 years, and Texas is there. So who have had a Pap test in the past 3 years, and Texas is in one of the states that's in the red. And so when it comes to death rates for cervical cancer, we do have relatively low rates, of course, because it is such a treatable cancer. But we're looking at increasing HPV vaccination rates. That's one of the other big kind of things that's going on in terms of statewide coalitions, as well as making sure we're getting as many women screened for cervical cancer as possible. So now I'll move on and actually talk you through how the Papalooza works. It's a pretty cool event. It's like organized chaos, basically, and there's lots and lots of moving parts. And, you know, because we are in Texas, I decided we would Texas two-step our way through it. So the first thing that you want to do with the Papalooza is to assemble the team. And so this event will have anywhere from 7 to 10 team members, and you'll have your essential staff roles as your project or your floor manager. So you'll have kind of that one person that's overseeing everything. Then you'll have your medical providers. So you'll have your team of providers, however many nurse practitioners or family doctors or gynecologists who are going to be actually doing the Pap smears. And, you know, you kind of want to pick your providers who move the most quickly, but are also the most thorough, so that you get really good efficiency, because you're not going through a typical well woman exam. You're really just doing the clinical breast exam, the Pap smear, and you're just kind of rolling as many people through the system as possible, because it's meant to be a mass screening event. So ideally, you want to be able to screen anywhere from 25 to 50 people, depending on how big your team is and what your capacity is for your particular health site. So in addition to medical providers, you definitely need your medical assistants on board. You need to make sure that your front desk folks are on board, and that they know what's going on, that they understand that you're going to also need to have people who greet your patients, and let the folks who are here specifically for the Papalooza event, letting them know, hey, this is where to go. We'll direct you through it, because this doesn't happen on a day when the clinic is shut down. This happens still during regular clinic operations. And so you're still going to have your general, you know, folks that are coming in for their well child exams or for their sick visits, that kind of thing. So you want to make sure you keep the line as smooth as possible. You'll also, in our case, we do mammograms on the same day. So we partner with 2 organizations here in Houston that provide mobile mammography. So the women who are age eligible or risk eligible, whenever they go through and they finish their clinical breast exam and their Pap smear, then we route them out to the mobile mammography van so that they can get their mammograms done as well. And then before they leave, if they're age eligible, then they can get a fit test as well. So we know that many of our patients are not only linguistically isolated, but here in southwest part of Houston, a lot of our patients are also geographically isolated. A lot of our patients come to us on foot, and a lot of them are taking public transit as well. And so if they don't have the means of a car, because if you're not from Houston, it's a big city, and you pretty much need a car anywhere you're going to go if you're going to cross the city. And so for our patients who come to us, we understand that we want to give them as many services as we can in one visit so that they don't have to consistently come back to us, because that is such a huge barrier. And so once you assemble your team, we also work with our care coordinators here at the clinic, because they serve as kind of our bridge between referrals. If we have patients who do have some abnormalities and they need to be referred to further diagnostics, especially if it's mammograms, if they need a diagnostic mammogram, we're also able to help out with referring them to that. And then if something does come back, like for example, they do come back positive for cervical cancer, for example, we're able to navigate them through that process as well and provide not only the referral systems, but also the psychosocial support that we have available here, because we actually have counselors, licensed professional counselors, who sit at our nurses' stations as well. And so once you've got your team assembled, the next thing you want to do is create some program guidelines. And basically that just means setting your eligibility criteria. So for us, the criteria that we chose, it was 3 of them. So the first one was the patient had to be uninsured, not had a pap test in the past 3 or more years, and Hope Clinic was not their current health home. So we chose these for a few different reasons. We wanted to make sure that we were offering screenings to the people who needed it the most, to the ones who couldn't get it done through their insurance. We also wanted to make sure that we were hitting people who hadn't recently been screened under the newest guidelines of 3 years. And then also we wanted a way to bridge people who normally would just come to screening events like this that were either reduced cost or they were free. We wanted to really connect them to a health home so that we could take care of the rest of their health, right? And then also take care of their family. If they're a parent, a sister, a daughter, whatever, we wanted to make sure that we were able to capture their whole family as well, and bring them in as patients in the clinic. So this also allowed us to set a cash price. So we established a $20 fee. That was just kind of based on what worked for us. But of course, depending on your health center, depending on your funding, and what you have available, you can certainly increase that price or lower that price based on your demographics. There are times where we do provide these completely free of charge. For example, if we have a grant, or occasionally the LabCorp office that we work with will actually just sponsor us, and they'll say, hey, you know what, we'll give you 100 free pap smears, which is really, really awesome. And we're able to help even more people. And so from there, in terms of creating your guidelines, just make sure that everyone's aware of those guidelines. The folks that are doing the outreach, the folks that are doing the registration and the promotion of the program, so that you are making sure that you're enrolling the correct patients into the program, which leads us into our next step. So because we are so multilingual here at Hope Clinic, we had several flyers and other outreach materials that had to go out in a variety of languages. And so our outreach specialists did a fantastic job and continue to do a fantastic job at making sure we market this particular program to the appropriate folks. And they also handle the registration. So we created just some pretty simple registration forms and also reminder cards, so that when they register, they get their reminder card, so their appointment is set down for them on that particular date. They know when they're coming in, what time they're coming in, and what services they'll be getting. So if they're going to get a mammogram that same day as the Papalooza, if they're also going to have an opportunity to pick up a fit test, or something that we're looking at with our next round of Papaloozas coming up here in the fall, is actually when we register people, giving them the fit test then, so that when they come back for the Papalooza, then they're able to drop off the fit test as well. So we're going to pilot that and see how it goes. So once you've got your folks registered, it's really, really important to do reminder calls and make any adjustments to the schedule as necessary. We highly recommend doing 2 rounds of reminder calls. So one relatively early on, and then the other 1 or 2 days out. That way you have a confirmation whether or not somebody is actually going to show up that day. And then the next step is getting your clinic and staff participation. So really this is just, kind of a huddle the day before the event to make sure that everyone's on the same page. You assign X number of patients to X number of providers that you have. You make sure the MAs are briefed and they know what's going on. Make sure your front desk is up and running and everyone knows what their part is in this so that you can make sure you have a smooth flow. And then make sure you get a good night's sleep that night because it's going to be quite a hectic day. But the more you do it, the more, the better you get. So the big day is your Papalooza. So that's the day where everything happens, and hopefully with enough planning and logistics and run-throughs, you will have a nice and smooth event. So the last thing is that you don't want to forget to follow up with your patients. The protocol that we used was for any patients who have abnormal or test results that we're concerned about, we would actually just go ahead and follow up with them within 2 weeks. But we told our patients that, hey, if you haven't been contacted within 2 weeks, then your results are normal. So that way you don't have people constantly calling the clinic. And then another way we kind of also help out with that is we have a patient portal. So we direct patients to that portal as well to be able to look up their lab results. So over the 3 years that we've been doing this, we've executed 13 events and we've screened a total of 401 women. So that wraps up my presentation. If you have any further questions outside of this, feel free to contact us, and I will turn it back over to the team.
Okay, Ashley, thank you very much. Let me see, I'm going to go back to the main slide. Bear with me for a second right here. Okay, so now your time to ask any questions. And I also wanted to let everybody know that we will have the slides available on the Nuestras Voces website, and I assume Apia will also, I'll send them copies as well so they can also make them available for everyone. And we also have the recording available as well in case you want to share the information with your colleagues. They can also do the webinar at a different time. And I wanted to share my contact information here. So feel free to contact us anytime. And, any questions and anything that we can, any type of technical assistance that you guys need, and, the Appeal and Nuestras Voces will be happy to help you. So let's see, we have a couple of questions here. Okay, this is for Rosa. Rosa, great presentation. Were you able to determine what was the country of origin of the Latinas in your study?
Yes, a lot of them were from Central America, but majority were from Mexico, which it really matches with the area where we're located here in East LA of Los Angeles.
Okay, thank you. Let's see. Okay, look, hello from Boston. Are you able to share the presentation so we can review and also share with others here around New England? Also about a video, can we share it with others, local and international? And this is Bess Nancy from College Pension Navigator. Okay, Rosa, I will post the slides as well, and I'll usually convert them to PDF, so people should be able to access the video for the tamale lesson. Can you just give a quick description of what the tamale lesson is about?
Yeah, so the tamale lesson is a video that we came up with which actually talks a little bit more as to the importance of getting a cervical cancer screening and what HPV is. So it's a dialogue that takes place on La Quinceañera, which is a cultural event among Hispanics. And there's older Latina woman, the mother, an aunt, and two sisters that start talking about what is HPV and how the Pap test is actually done. So it's a bit comical because it also uses a chicken to kind of demonstrate that. But it's something that you would definitely enjoy. You can also email me if you would like a copy, because we do have the narrative and non-narrative version of the video. So if you're interested in obtaining a copy, please feel free to email me, and I'll be more than happy to share and send you an email, a physical copy of the video.
Great, thank you. And I have a question for both presenters. When you guys provide, I mean, I know, Rose, in your case, you guys working with one of the community clinics, but USC also has a comprehensive cancer center. And I know Hope Clinic is a community clinic. Now, do you know when you guys provide the screening services for the women who are uninsured and low income, did you guys provide the services from the CDC breast and cervical cancer screening program?
Yes, we do here at USC.
Okay.
Here at Hope, we haven't, but it's something that we're looking into doing moving forward.
Okay, very good. And for the first presenter, what is the name of the published paper mentioned in the presentation?
It is Tamale Lesson, and it's a case study of the narrative health communication intervention. I will go ahead and send a copy of the paper to Marcela, and also a list of other publications that we have published based off this study that can become a resource for any of you that may be interested in reading some of those articles.
Great. Rosa, will I be able to post it on the website as well next to the slides?
Yes, absolutely.
Okay, great. Let's see. Any more questions? We still have a few more minutes. Okay, let me see. I think we get another one here. Can we share the poster for the Jacaranda campaign in New York and internationally?
I will go ahead and check back with you on that, because I know we're going through some copyright issues here with the university, so I just want to make sure that everything has been clear before it gets shared throughout other parts of the state, but it's definitely something that I can follow back up on.
Okay, great. And I also wanted to let you know that we also, in the handouts that I uploaded an infographic that Hope Clinic prepared. It's a pretty cool infographic, actually, with the different steps to have the Papalooza. So make sure you download that infographic as well, and it's in the handouts. And I'll probably go ahead and post it as well when I put the information on the website. And I assume Camille might do the same at Appeal, so that way everybody can have access to the information. Okay, I have one more question here. Okay, do you have a number of Latinas testing positive for cervical cancer? And I assume maybe that's for both presenters. Did you guys have any data on that? I mean, do you have any information on that specifically for women who came to get the screening and then actually they were positive for cervical cancer?
I don't have that information at the moment, but I can definitely reach out to our data person and find out. Okay.
For ourselves here, since we were working with the clinic directly, we also had to be conscious about their IRB requirements. And at the time that we have conducted the study, their IRB did not allow for them to share some of that information, but just the percentages and findings. So we don't have the actual information, since that was something that became something very sticky into trying to get that. But we did ask specific questions more related to the campaign and tracked as to the number of patients that actually began to visit the clinic because they either received a postcard from the clinic directly or because they had seen the outdoor media campaign.
Oh, okay, good. Yeah, and Elena, feel free to send me an email as well, and I'll and when Ashley shares the information, I'll be happy to send it to you as well. Let's see if we have any questions more here. Now, actually, you mentioned that you guys are doing this. You've been doing this for how many years now, the program, the Papalooza?
It's been about 3 years.
And you plan to do it, you do it like once a year?
So previously we were doing it almost quarterly, but yeah. So it's been about 8 to 9 months since we've done one. So we'll be doing one this fall in October, and then hopefully moving forward, we'll have funding to start doing them again more frequently. We're applying for some grants right now to be able to sponsor them.
Okay. And then Rose, and also Ashley and Rosa, do you guys know, I know Rosa, you mentioned you're also doing the campaign. Is it being implemented as well? The Es Tiempo campaign?
Yes, we do it every summer, and each summer, due to funding, the lack of funding, that has been a little bit of a struggle. But I know that this campaign can sound like it can be very expensive, but it doesn't necessarily have to be. I know that it's a campaign that can be done with small amount of funds, which is at least under $30,000 or $25,000. It all depends on the resources and contributions that you get. But
Yeah.
the longer you're working on the campaigns, then it becomes a little bit easier, even if you get little small donations, but then you can cluster them in order to make parts of the campaign adjustable.
Oh, good to know. And then I have one more question here from a participant. Did any campaign include more about the HPV vaccines for the children, or was it more focused on screening adult women?
It actually, no, it was composed of both. But of course, we had to change and update the campaign based on the new data and screening resources. So I know that, for example, at the beginning, the age of the woman has changed. So that's something that we also have to go back with our data and kind of run different numbers. So we did also include the children and provided some information. And even when we were interviewing some of the women, we asked them whether they had any children themselves or any young children within their family, and what were the ages, to kind of assess as to the knowledge also as to them and the likelihood of them actually being willing to vaccinate some of the children.
Okay, great. And then one more question here for first presenter. How the clinic use the toolkits? Did they collaborate in outreach as well?
We are still finalizing the toolkit, and the clinic is actually being involved into the development of that toolkit. So one of the slides that I presented, it shows some of the material that we have, but they also wanted to include and bring to the table the community health workers, because they felt that that piece, they would know more the best as a patient as to how to obtain this information for them and disseminate the information. So the clinic has been a major resource, but it's still under development. I know that we have a lot of different items compiled to the toolkit, but the clinic is planning not only to disseminate it at both sites of their clinics, but also share it with other clinics that they have been collaborating with, where they stay in communication as to what kind of patients are coming. Because as we're located in Los Angeles, I know we have a clinic here at LA County USC that also is interested in it. So they want to have a better resource to be sharing not only the information, but also some of the patients that they can be sharing the resources with them as well.
Thank you. And I have another question. Ashie and Rosa, do you guys know if these programs have been replicated in other cities or in other communities, as far as you know?
Hi, this is Rosa. Yes, we actually tested this campaign also in Panama, and we had a medical student here at USC that took the entire campaign in Panama and tested it out, and it seemed to work and resonate very well. So I know there's also a publication that student worked with the colleagues that we have in Panama and their IRB institution as well. So it's something that worked very well, and I know that it's something that has been started to be implemented into their community clinics in Panama. And I am aware that they also try to take this to El Salvador and see how that also resonated there. And I know that is still in progress, so we haven't heard of any of the findings or how things are going at that end.
Great. And Ashe, do you know if the Papalooza has been replicated in other cities or not yet?
I'm not sure if it's been replicated in other cities. I know it hasn't been replicated here in Houston, as far as I know, because we're one of like 13 health centers,
Okay.
QHCs in the greater Houston area.
Okay, thank you very much. Thank you, the two presenters. We really appreciated your participation. And I think we're up to the hour. Oh, 4:01. Sorry for keeping you 1 minute extra. And I want to remind all the participants that you'll be getting a link, an email message from the GoToWebinar to provide feedback in a very short survey. So please complete this survey. It's very important to us that we hear from you. And again, the information will be posted on the Nuestras Voces website. Feel free to contact us at any time. Camille, any last words from Appeal?
No, thank you so much, everyone, for joining.
Thank you, everyone.
Bye.
Bye.
Thank you. Have a great day.